Good evening, everyone. So my next video on the topic is on the topic P-Jug exercise 2. In this video, I'm going to discuss with you P-Jug exercise, one P-Jug exercise with you. And in previous video, I discussed with you on the mild hypertension. In this video, I will discuss with you on some other disease like acute attack of angina. And before I start my video, I want to request you that if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Now, I'm going to start with you P-Drug exercise 2. Now, case presentation 2. That is, a patient is a 60-year-old man came with complaint of suffocating chest pain, radiating in medial aspect of the left arm, which began during evening walk. Means there was the chest pain, suffocating chest pain to the patient, 60-year-old male, and the pain was radiating towards the medial aspect of the left arm. And it began during the evening walk. What is the diagnosis? It is angina pectoris. Angina pectoris is strangling chest pain, and attack of the angina pectoris occurs when myocardial demand for oxygen exceeds supply from the coronary circulation. Means when the oxygen demand exceeds the oxygen supply, there is pain in the coronary arteries, vasospasm of the coronary arteries. When demand increases the supply, and then that can lead to chest pain in the patient. Define the diagnosis. Now, forms of angina, this can be divided into unstable angina, which is pre-infarction or crescendo. Stable, commonest, classical, effort-induced, and Prinzmetal's variant is spastic, vasospastic. And stable is when the patient is normal at rest, there is no chest pain at rest, but it is increased or it is increased when the patient is on exertion, is doing some exercise, then the chest pain can occur. That is stable angina. Unstable is there is chest pain even at the rest. The patient is suffering from the chest pain even at rest. Prinzmetal's angina is when there is vasospasm of the coronary arteries and the patient is suffering from the chest pain even at rest, and that may wake the patient from sleep also. Rest angina. When there is vasospasm of the large coronary arteries, there is Prinzmetal angina. Now, how we have to define a diagnosis? It is the acute attack of angina. There is strangling chest pain in the patient, and it is radiating towards the medial aspect of the arm. So, the diagnosis is acute attack of the angina. Specify the therapeutic objective, which is to abort an attack as soon as possible. Means we have to reduce, we have to stop the attack as soon as possible, and we have to prevent the further attacks of angina and complications like myocardial infarction. Now we have to make the third step is we have to make the inventory of the effective groups. The drugs are the nitrates, the beta blockers, and the calcium channel blockers. The nitrates release nitric oxide, they cause vasodilatation. So they decrease the venous return, decrease the end-diastolic pressure, so decrease the preload. So these can be used as the treatment, most effective treatment for the treatment of the angina, acute attack of angina. Beta blockers and calcium channel blockers, they decrease the heart rate and they decrease the cardiac output, they decrease the afternoon. Now, what is the, we have to choose a group according to criteria. This is cost, efficacy, safety, suitability. Cost of the beta blockers and calcium channel blockers is less as compared to nitrates, but efficacy wise also these drugs are very suitable. I've already discussed the mechanism of action. These are all efficacious, but nitrates, these are also safer. Only the side effect is postural hypertension. Suitable is the nitrates come in tablet form. So sublingual tablet, its action is instant. Instant action is there by the tablets. And beta blockers, these are given in injection form. So these are less suitable. And these are injectable injections. So these decrease, they have a less duration of action is also more. And these are less suitable to be taken in the injection form. Nitrates, they come in tablet, sublingual oral tablet, which can decrease the attack of the angina as an instant action. So we can say that this is more suitable. Efficacy-wise, these are same. Nitrates are the effective group for the choosing or the pre-criteria, the P drug. Now, the FP drug from the other, the types of nitrates, crystalline dinitrate tablets, spray of the crystalline dinitrate, isosorbide dinitrate, isosorbide mononitrate. The efficacies are similar, safety is similar, suitability is similar of all these. The only difference is in the cost. So the crystal dinitrate, it is having the rupees 25 rupees cost, and these are more suitable. Sublingual tablets are available. Spray is costly, so it is less suitable, less for the less more costly, so less suitable for SCP drug, and the crystal dinitrate sublingual tablets is available and it can be given as the P drug. 25 rupees is the least cost. Conclusion: active substance, that is the dosage form is crystal dinitrate sublingual tablet. 1 milligram can be given, 1 tablet as needed. We have to give the dose schedule, and second tablet if pain persists. Duration is length of monitoring interval. So that's all for the P-drug exercise 2 on the acute attack of the angina. I hope you like this video, and if you like this video and if it is useful to you, kindly subscribe to my YouTube channel. Let's Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Stay safe. Happy learning. Thank you.